Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teele. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teele, as she brings information to you that may just be the caregiving solution you need.
Welcome, everyone, to Caregiver Solutions Info. If you're watching us on caregiversolutions.info or whether you're listening to us in South Florida on local radio, I am so glad that you are here. We are live from Boca Raton, Florida. We're here every Tuesday to bring you the latest in challenging behaviors that you can overcome, because it is very difficult to be a caregiver when you're caring for someone with Alzheimer's disease or some other related dementia. The road is long and the road is rocky, but with extra resources like the show, it can help you along your journey. And so we're glad that you're here today. We have a wonderful show for you. My name is Marcia Teele, and I have been helping caregivers for over 15 years. So, you know, we understand what you're going through. It is something that no one really understands unless they've walked in your shoes. And so this show is for you and other caregivers, so please share this information with them and let them know that they can tune in also. If there is something that you hear on the program, if there's something that you want to hear on the program, or if you have a comment, please email me. I would love to hear from you, and we will address that on the following week. So you can email me. My email address is delray@arden-courts.com. Again, Delray, that's DELRAY, at arden-courts.com. This show is brought to you by Arden Courts Memory Care Community as our national sponsor. And as such, Arden Courts has over 52 communities across the United States that's dedicated 100% to memory care. Now, we're talking about being a caregiver, and caregivers need a lot of support because this is something that Arden Courts is very passionate about, education for the caregiver. We would like to go ahead and let you know that if you take down this phone number I'm going to give you and call the toll-free number at Arden Courts Memory Care Community, they would love to send you a free book. This is the 36-hour day book. It's a family guide to caregiving. It's an excellent resource, and it's yours free just for calling the toll-free number, which is 888-478-2410. Again, 888-478-2410. Tell them that you heard about this offer on the Caregiver Solutions Info program, and they'll get your name and address and be glad to send you out a book. This book is full of tips. It's full of advice and information, and you'll want to have this for yourself to look up things as the time goes along. From the beginning stages of Alzheimer's disease until the very end, you'll find this book very helpful. So that being said, today we're going to be talking to two experts in the field. We bring experts onto the show, lots of information because, you know, you get the advantage of hearing them. We ask the questions, you get the answers. Sometimes we actually have caregivers on the program, so you can hear from people that are your peers walking in your shoes. And sometimes we even speak to the patients that have the Alzheimer's or the dementia. And it touches my heart because they're willing to share that information, and they're still able to share from their point of view what they're going through. So no matter what we're going to be presenting to you, you're going to find it hopefully helpful. Today we're going to be talking to two experts in a nursing home situation, skilled nursing facility, and we're going to be talking about the differences between an assisted living for memory care and memory care in a nursing home. And sometimes people get those two things confused. So we're going to go through and explain that and talk about lots of things that hopefully will enlighten you. So today with me, I'm very excited to have here in the studio two wonderful people from Heartland Healthcare Center here in South Florida. This particular Heartland is in Boynton Beach. And with us today, we have Althea Brown, and she is the Director of Nursing at Heartland Healthcare Center. And we have Janet Dadia, and she is the Administrator at Heartland Healthcare Center. Welcome, ladies.
Thank you.
Thank you for coming today. I'm very excited to have you here today. There's a lot of talk about memory care. And, you know, when someone goes to the doctor and the person is diagnosed with Alzheimer's, let's say, the first thing that they think of as, well, we're going to need memory care. But there are choices out there when you're looking at what stage of Alzheimer's versus what the resources out there are required. And so we're talking now about nursing home, and we're going to be talking about the differences between assisted living, which is an Arden Courts for memory care, and Heartland, and you are memory care for nursing home, right? Mm-hmm. So let's talk about that a little bit. First of all, I want to let everybody know that not every nursing home has a capacity or a capability to take care of certain types of patients, especially ones that have Alzheimer's and maybe have some behavioral problems. So can we talk a little bit about that, about what is an ideal patient for Heartland, because you all specialize in memory care? So go ahead, Janet.
Well, most of our patients are somewhere between the mid to the end stage in their disease process. As their disease process starts, caregivers normally will see changes in their patterns, their day-to-day patterns, and once they identify those, they are able to then determine at that point where the appropriate setting may be. So in a memory care, an assisted living memory care, the patients there will typically be those who are in the beginning stages that still can provide for their ADLs on their own. And then once they start to progress and enter into the next stage, then the family then sometimes wants to look toward a higher level of care, and that's where the skilled nursing comes in.
Right. So let me jump in there, because that's right. There is a difference in levels of care between a memory care assisted living and a memory care nursing home or skilled nursing facility. Now, can we use those two terms interchangeably, nursing home and skilled nursing facility? Are we right in assuming that those are interchangeable terms?
Yes.
Okay.
Right.
So I just want everybody to know, because sometimes people say nursing home, sometimes they say skilled nursing facility, but it also depends on what services you're getting in that particular building, because some services are skilled, which we'll talk about, and some services are not skilled. And we'll get into that in just a moment. So, but if we're using those terms, just so people know, we can use them interchangeably, but they are different depending upon the services that you're receiving.
That's correct.
Okay.
Yes.
So that being said, in an assisted living for memory care, the residents, we call our patients residents, because this is where they live. It's their home. When they come from home and they don't need a nursing home, then they can come to Arden Courts, and Arden Courts is their home for long term. They are appropriate by meeting the guidelines of the state of Florida for being appropriate to be in a dementia assisted living. That being said, first of all, they have to have a diagnosis of dementia. If they don't have a diagnosis and they obviously have dementia, then, they're going to go to the right doctors and get that diagnosis. But there are certain things that would prohibit someone who has Alzheimer's from coming into an assisted living setting. And I get this a lot with caregivers. I get where, they call me up and they say, my husband has Alzheimer's, and so, he needs a nursing home. And so when I start asking questions about the husband, tell me, how does he walk? How does he talk? Does he have any medical conditions? What are some of his behaviors? What kind of medication is he on? These kinds of things. And I find out that actually the man does not need a nursing home because he is quite capable of having his needs met in an assisted living for memory care. And that's where I think a lot of confusion, comes into play.
Absolutely.
So when someone does come into assisted living, yes, they usually, at least with Arden Courts, can stay long-term, even toward the end of life, because we can bring hospice into their home at Arden Courts, just like hospice can come into the home, in their private home. So many times where it would be necessary, let's say, for someone to leave the Arden Courts memory care and go to Heartland, they can stay because of having the support of hospice on board, so that it sort of softens those rules that says if hospice is involved, then they can stay. There are times when obviously somebody doesn't qualify for hospice and they don't meet any longer the qualifications to stay in a memory care assisted living. And that's what I want to talk about today. So let's kind of set up a scenario. Mm-hmm. So if we have a gentleman, let's say, that is in an assisted living, he's appropriate, he's been there for memory care for a long time, but all of a sudden he is not eating, which is very common sometimes with Alzheimer's, as you know. And let's say that he does not have a living will, and the family and the discussion, the gentleman prior to him being diagnosed with the disease, they want to keep him going for as long as possible, meaning that they're going to put in a feeding tube.
Correct.
All right? Now, let's talk about that, because in assisted living, not allowed feeding tube. But tell me about feeding tubes. Alfie, I know you're director of nursing, so you probably deal with this a lot. So tell me about what happens when someone needs a feeding tube.
First, we have to go through the process of diagnosing. Is this person not able to eat because there is a swallow problem, or is the patient just does not want to eat? So we have to figure that out. And usually the patient will go from you to the hospital. When they go to the hospital, then the tests are done, the swallow studies are done. If it's diagnosed or deemed that the patient cannot swallow because of dysphagia, then the tube goes in. Sometimes the dysphagia is reversible. So then they'll come to the skilled memory care facility. And there we're going to work with them with speech and try to revert them back to eating normal. If that's, not that the patient doesn't want the food anymore. It's just that at that point there was a disease process where the swallow ability, just decreased. So we'll go through, and that's when we'll have our memory impaired patient comes into us. We'll try the speech therapy, and usually we get patients going right back to the ALF from there, and we've had that happen before.
Okay. So that's a situation where they're into the nursing home, but they're getting skilled care. Would you consider that skilled care?
Skilled care,
okay.
Correct.
So explain what skilled care is versus custodial care, because caregivers don't sometimes understand the difference, or they've never been told what the difference is. So explain skilled care versus custodial care.
Skilled care, patient comes to us, the therapist comes in, and the therapist eval, okay, this patient is able to, we did a MBS, the swallow study, there's something going on, we can work with it. They've worked. The ALF is not able to work with that. So in the skill memory care, we do that. And the therapist is there daily. They'll work with them throughout the day. We have CNA that sits there and follow up with what the therapist has taught them to do to continue that feeding, to just get that patient, routine back to normal.
So it's therapy.
It's therapy with the therapist, along with the aides, along with the nurses, along with just the whole we have a whole different ball game.
The whole team that you work with.
Have, yes.
So besides the swallowing problem that you're helping them with, and they're getting the skilled care for that issue, what are some skilled services that can be provided in Heartland, which is a dementia-specific nursing home. What other skilled things are we talking about?
Therapy, physical.
There's physical therapy, occupational therapy, speech therapy. And I think it's really also important for caregivers to know that a skilled service is not just therapy, but it's any condition that's an acute condition that is an acute onset of something that's come up that requires the level of nursing care, actual nursing care to care for that patient.
So a lot of people are pretty familiar with physical therapy,
right.
And if they had a time in the hospital and they've been in the hospital for a while, sometimes their legs will atrophy, and they need to go from the hospital into a skilled facility for the physical therapy to get them stronger, right? So they can go back home or go back to the assisted living. So we're going to take our first commercial break, and when we come back, we're going to talk about what are the differences between a skilled nursing home and one that is specific for dementia and one that's not. So you'll want to know this, and you'll want to take some notes. So stay tuned. We will be right back.
Arden Courts is not just a place to live. It's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Feelings of depression, isolation, and frustration are common among persons living with Alzheimer's or related dementias. It's common among those who care for them, too. It takes a lot of patience and courage. It also takes knowing when you can no longer do it alone. At Arden Courts, memory care is all we do. Talk to us. We know, we understand, we can help. Don't let guilt keep you from making the right decision. Visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines.
You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
And welcome back to Caregiver Solutions Info. We're talking today about the differences between a memory care assisted living and a memory care nursing home or skilled nursing facility, and getting into the nitty-gritty about when someone does have to go into a nursing home. We're going to be talking about what to expect, how do you choose one, what do they do there, how is it paid for. And so with me today we have Janet and we have Althea. And thank you, ladies, again for coming today. Janet is the administrator and Althea is the director of nursing, both from Heartland Healthcare Center here at Boynton Beach, Florida. And both of you have actually been there quite a long time, right?
Yes.
About how long?
I've been there 6 years now.
Okay.
Yeah.
But in the field of being an administrator?
In the field, yeah, 20 years.
20 years,
Yes.
Okay. So you're an expert for sure. And I know, Althea, you've been a nurse and a director of nursing for a long time, too.
Yes, well, I've been a director of nursing for 6 years, at Heartland for 8 years, and I've been a nurse for 15 years.
15 years.
Yes.
And myself as well, 15. So, I mean, there's too much knowledge in this room right now, but we're willing to share it, and I think that's what's wonderful about people who come onto the program, they want to share. They want you to know what they know so that you'll have an easier time when it comes time to doing whatever it is that you need to do for and with your loved one. So we're talking about skilled nursing. We have a scenario we set up about a person who needs physical therapy, let's say. All right, so they come from a hospital setting, like you said, Althea, into a skilled nursing facility for the physical therapy. So what happens when someone comes in? You know, it's very confusing. You're at the hospital, and now the discharge plan at the hospital says, okay, you're going to go for physical therapy at this nursing home. What does a caregiver have to know? Do they have to go and, do a lot of paperwork? I mean, what's the process for them to understand it?
Well, we recommend all of our caregivers to come in and do a tour. Do a tour of the facility first to see if this is something that they would want for their loved ones. And then after that, they have to decide, is this, their family members coming in for rehab, or what is the goal? What is the long-term goal? Because we have to set that straight from the beginning to know what are we going to work on when this patient comes in.
So good point, because if they're coming in for a skilled service like physical therapy, occupational therapy, speech therapy that you mentioned, that's one goal, right?
Correct.
But if they're coming in long term and they're going to live there till they go to heaven, that's another goal.
Yes.
So you got to find out what you're having to help this family with, which is very important, because without a goal, you don't have a plan.
Right.
Yeah.
And
so
then ask questions. You have to ask a lot of questions, because if your loved one was home and, say, for example, wandering at night, what kind of facility do you have? Is it something that's secure enough that when they start wandering, they won't go through the door and then get missing? We have to make sure those are in place. You know, what is it that you're looking for? Staffing ratios. Do you have enough staff to provide care? Is your family member incontinent, where you're going to need that incontinent care around the clock? Is it the patient's going to need wound care? Because we do wound care. We do, what is it? So those are the questions. Make a list of every single thing that you're going to need. When you come in, you're going to get a tour of a facility, activities, see what we do as far as activities to keep them busy throughout the day. Meals, what kind of meals do we provide? Those are things that are real important to most families, and you need to know that from the beginning.
So they need to have a list of questions of what
Correct.
they want to ask you in case they forget, because it's a stressful situation, and people don't always think of everything on the spot. So that's a very good idea. So have those questions already written out. And then if they don't ask, I'm sure that a lot of things you're going to tell them anyway.
Yeah, we always prompt our family members that come in and ask them, the pertinent questions that we think they would need to know as caregivers in order to meet their needs.
Okay, great. So let's say that the person is needing physical therapy from the hospital, and so they're going to be getting what we call the skilled care, right?
Correct.
When someone is not receiving skilled care and they're staying long term and they're no longer eligible to receive skilled care under the guidelines of the state, that's when you call it custodial.
That's
okay.
correct.
So the difference then is you're either getting skilled services or you're still getting services, right? But you're not getting the skilled. So tell me what services would come under custodial care. I know it sounds like a trick question, but it's not.
Custodial services are traditionally your room and board. And then, the daily things that go along with that, such as your meals and your housekeeping, activities, any maintenance that may need to be provided, your nursing care, your CNA care. Those are the things that go along with your custodial care patients or our long-term care patients. The skilled patients require a little bit higher level of care, and so they're usually there for physical therapy, occupational, or speech, and because they have some kind of acute condition that we're treating at the moment.
Okay. Now, let's talk about payment. When you're talking about payment in a nursing home, it's a difference whether it's skilled or custodial, correct?
Yeah. Skilled patients are traditionally in a facility under Medicare. and private insurances, so your managed care companies. Most of patients who are living in the facility as long-term care patients are there under Medicaid, or private pay. So either one of those.
Okay.
But Medicare and managed care does not pay for custodial care.
Right. And that's why we want to set up the scenario so people would understand, because it's very common for people to say, well, does Medicare pay for my loved one to live in a nursing home for the rest of his life? The answer is no. So Medicare is paying for that skilled care, and only to a certain point.
Correct.
Right? And this is where you all come in at Althea as director of nursing. Take the scenario of the man coming in, he's getting physical therapy, and he's in there for a week or two. What's the process that you use to determine how long that person can continue to receive his physical therapy? Is it unlimited?
No, it depends on their insurances, of course. And then what we do as a facility, we set up a care planning session for the family members. And they come in and based on the insurance, we go over, okay, this is covered, this is not covered, how many days. And it all depends on the progress that the patients are making. Because if you're qualified for 100 days and within 30 days you've met all the goals that were set, then your time will be short. So it all depends. But we sit with them and we go through every single thing that they need. That's their opportunity actually to sit down and say, this is what I'm seeing. This is after they've been there because we do it 14 days or 20 days after. Sit down and
with the family.
With the family, with all the departments, the therapist, the dietitian, nursing team, social service. We'll sit down and go over what the plan of care is, what they want to see, to be done, and so we can coincide everything together, put it all together to get a good outcome for that patient.
Right, good. Well, you mentioned something very important. You mentioned the magic 100 days. Now, I know there are a lot of people that assume that they're entitled to 100 days of skilled care, and that's not true.
Correct.
And just as you explained, that's the maximum they can get, but it's not an automatic.
Correct.
Right.
Yeah, so individuals who have Medicare are entitled up to 100 days, providing that they continue to have a skilled need for those 100 days. The interdisciplinary team, which is comprised of our nurses and our social worker and our therapists, all meet weekly, and we discuss the patient's progress at that point and then determine if we're going to continue on a weekly basis because the patient is either continuing to make progress or the patient is no longer making progress or the patient has reached their goals. And once that happens, then the team decides that the patient is no longer appropriate to receive benefits under Medicare. And so at that point, they can make the determination if they want to stay with us long term, or we like to see our patients go home or back to their prior living arrangement, because then we know we've done a good job.
That's right. That's your goal, is to get them better.
Get them back.
Yeah,
yes.
Get them back, get them better, get them home again, wherever home might be, whether it's home at Arden Courts or another assisted living or back in their own private home with the caregiver.
Absolutely.
Yeah, and that's the goal. That's really great because, again, is it possible for someone to be in your facility under skilled care receiving different types of skilled? Let's say they're there and maybe they're a mess and they've got wound care going on. They need PT, they need OT, they need lots of different things. So if you get them to the point where they don't need one and that's off the table, do they stay until the others are met and pretty much?
As the goals are met, they progress. As they progress, the goals are met, then they drop from that one and continue on whichever one is still, appropriate.
Okay. I know sometimes caregivers say, gee, I only have a couple days to find a place for my wife, right? Because sometimes you don't know when they reach that goal and you have your weekly meetings. Sometimes they only have a few days that you're giving them a heads up. Is that true?
Well, in our facility, no. We do follow up with the families. And like Janet explained, we do have the weekly meetings. And at those meetings, we look at, where they are with as far as goals.
Mm-hmm.
And as they progress, then we're notifying the family, listen, you know what, we're almost there. These are the options. Which one you're going to use?
Okay, so you're going to prep them,
right?
And they need to be on board with you so that there are no surprises,
right?
Okay, so if you are involved in your loved one's care along with the team at the skilled nursing facility, then you're going to get all the information you need to be prepared.
Correct.
And I think that's important. And the people that kind of are blindsided is because maybe they're just not that involved. But obviously they're part of the team, and it takes everyone, to coordinate all of that.
And that's one of the unique things with our facility. Because of the dementia product. Our families are involved. They're there. They're up in your face. They're okay. Where are we? What's going on? So they're aware of it way ahead of time.
I'm glad you said that, because my next question, because that was a great setup, my next question is, you, as Heartland in Boynton Beach, you are dementia specific, meaning that every single person, every patient in your building has memory loss.
Correct.
And so what's the difference between a memory care nursing home and one that's not memory care? What do you do differently?
Well, I think there are a lot of things that we do differently. Number one, all of our staff is trained, especially trained in Alzheimer's and dementia. And that's not just to say our nurses and our CNAs, but it's all of our staff across the board. And equally important is the fact that our therapists are trained, specially trained. Because when you are trying to rehabilitate a patient who has dementia, it's much different. The process is much different than it is if you were trying to rehabilitate, you or I. So that is very, very important. The fact that we do specialized programming is also critical when you're looking for a nursing home. So we have a dining program where our patients eat based on their functional ability. So if we are in a dining room together and there are 4 patients that can eat together independently, we want to sit them together because we want to help them maintain their independence. If there are patients who just need cueing, we want to seat them together because we want to try to continue to reinforce their being able to their motor skills for actually trying to eat. And then there are our patients who are totally dependent, and we sit those patients together so that our staff can assist them as they need.
And actually,
as well.
maybe actually feed them, spoon
Correct.
feed
Right.
them.
Spoon feed them, right. And then our activities are also based on functional ability. So we have specialized programming for patients who are very low functioning and patients who are a little bit higher functioning. So that all of our patients can actually participate in something. And the goal when you do activities with Alzheimer's and dementia patients, it's not what the end result is, but it's just actually getting them to do something. And sometimes the something actually is just maybe listening to music or just maybe smelling fresh vanilla or, just lights and sounds.
Stimulating
right.
The senses.
Things to stimulate the senses.
And that's important, and Arden Courts has a similar program. We call it the Namaste program for people that maybe because of where they're at in the dementia process can't actively engage in the regular activities such as the volleyball or the sit-down volleyball, or maybe they can't even participate in the sing-alongs as far as singing, but they certainly can be part of listening to the music. They certainly can be stimulated in different ways with their senses that they're going to get it on their level. And I think this is very important because not every assisted living for memory care and not every nursing home for memory care provides this. And I think it's important for caregivers to understand that stimulation is so, so important because without that, what is a person to do? They're there all day and you just don't want them sitting doing nothing and vegging and melting away, as I call it. And so it is important, even in a nursing home.
Right. And just like you, we've recently instituted a new program called a multisensory program. And it works off of a Swedish concept, which was called Snoozalin. And it was originally designed for children who had autism, and it has been found to work really great with our dementia patients. And so we have a whole room that's set up, works off of fiber optics and colors and sight and touch and sound. And it has had a very good impact on patients who have behaviors, because Alzheimer's patients have behaviors. And I know that that's a subject that's, the big elephant in the room for a lot of caregivers who have Alzheimer's patients or loved ones with behaviors.
It really is. It really is. They don't like to talk about it, let alone admit it.
Right.
So you're finding that this particular programming that you have helps to calm the patient.
Absolutely. It helps to calm them. It's reduced behaviors. It's reduced incidents as well. And it also has allowed us to move away from some of the traditional antipsychotic medications that patients have to take to kind of, calm those behaviors.
And I'm glad you said that, Janet, because when we come back from our next commercial break, we're going to be talking about medications and answering some of those questions about why do people need medications to calm them, and we're going to be talking about the kinds of medications, when they need them, when they don't need them, and ways to reduce medications. So stay tuned. We'll be right back.
Do you need the...
Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Somewhere at the corner of bewildered and confused is a lost mother, a father, a sibling, a grandparent. Wandering is a common symptom of Alzheimer's or related dementias and can often make those who care for a loved one feel just as lost. If you're looking for a place that's safe and secure, look to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Feelings of depression, isolation, and frustration are common among persons living with Alzheimer's or related dementias. It's common among those who care for them, too. It takes a lot of patience and courage. It also takes knowing when you can no longer do it alone. At Arden Courts, memory care is all we do. Talk to us. We know, we understand, we can help. Don't let guilt keep you from making the right decision. Visit arden-courts.com. Arden Courts.
You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
And we're back here with Janet and Althea from Heartland Healthcare Center. And we're talking about the differences between a memory care assisted living, a memory care nursing home, and the difference between a memory care nursing home and a non-memory care nursing home. A lot of people have, confusion about that. So we're just left off. We're talking about medications. And if you do have someone that you're caring for that has Alzheimer's, you're going to experience most likely some negative behaviors. And that's what we're talking about now. Let's talk about those negative behaviors, because certainly if somebody comes into either an assisted living for memory care or to a nursing home for memory care and they're violent, they're not allowed to stay, right? Mm-hmm. They are a threat to the other people.
Themselves and others.
And to others,
right.
And to themselves even sometimes, because they can't control themselves. So how do you address that when someone comes into a nursing home for long term and their dementia has progressed to the point where, it's getting end stages, you can't, really control them by redirection. Let's get to the nitty gritty of it, and they need medication. I always say, drugs can be a good thing, but only when they do what they're intended to do. And let's talk a little bit about medications and talk about when people need something, when they don't, and what makes the difference.
Well, most of our patients come to us from the hospital, and I guess sometimes the hospital would think that they're stable, and they'll come in the building and maybe 10 minutes violence, throwing stuff, we have to kind of redirect, get patients out the way, do all of that. Those patients, usually we'll send them back out even before we do anything, because at that point they're a danger to themselves and others around them. And
that's a regulation by the state that
yes.
someone cannot be a danger to themselves or others and stay
that's
in that environment.
Correct.
So you have to address that right away.
Right. But then for, our patients who are stable and they come in and they're on medications, and we're talking about the psychotropic meds. And we do not like to give psychotropic meds in long-term care at all, especially with dementia patients. But when they come in and we do not know them, we have our psychiatrist that comes and evaluates the patients. And based on that, we'll continue or, decrease or discontinue. But straight off the bat, someone was Baker acted because they did something that was violent. Then we monitor. We do have psychotropic meetings monthly. And in between that, while we're monitoring the side effects for these medications that they're on, along with, because some medications like Geodon, for example, you have to have that EKG. So if everything is okay, we're monitoring and we're looking at them, and we see the behaviors are non-existent anymore, then psych will go ahead and say, okay, let's do a dose reduction.
Okay.
And we'll do that.
So we actually can reduce the amount of medications they're taking. And that's actually a good point that you just brought up, because some patients from the hospital go to a skilled nursing facility to get stabilized, to watch their medications. And you brought up a good point, because you're there, you're the experts, you're the nurses, the doctors, and you're monitoring the person as they're going either on or off different medications to see what agrees with them, what doesn't agree with them, if you need to increase, decrease to get the right amount, because there is no magic pill for everybody that's going to just stop what you want them to do because of the side effects. So I think that's very important too, that people should know that just because they go into even a geriatric psych ward in a hospital, they're there to get stabilized, and then they can be discharged from there, still come into skilled and get a little bit more adjustment, and get them stable. And that's important, because you can't do that at home.
No.
And I think it's important to remember, too, that a lot of times behaviors are a result of something that's going on with the patient, whether it be they're in pain or they're cold or they're hungry. So those are the things we look for, and then we try non-pharmacological interventions first to see if we can try to reduce the behaviors that way. And if we can't, that's when we resort to medications.
Okay. Big word. Non-pharmacological. All right, explain what you mean by that.
So a non-pharmacological intervention is one which does not require any medication. So if we have a patient that may be yelling or screaming out, we might try to offer that patient fluids, or a cold beverage, or maybe a back rub, or maybe they need to be toileted.
Because you don't really know what they need at this point, right? Because they can't tell you.
Right. And then we try to, we try all these different interventions to see if any of those work. And if something works, then we know that this is what we need to do every time this patient has a behavior, as opposed to, resorting to non-pharmacological interventions.
And I think that's wonderful, but not every place does that. I think a lot of fear from the caregiver's point of view is they're going to go to a nursing home and they're just going to get socked with tons of medication, and they're going to be out of it, and they're going to just sleep all the time, and they're not going to have quality of life. So that's why it's so important for the intervention, like you talked about, to see what is it that they really are having a problem with, and how can we fix it without just giving them a pill.
Right, and I think that's probably one of the biggest differences between a facility that specializes in Alzheimer's and dementia and one that doesn't, because a skilled nursing facility that doesn't specialize is not going to have the patients and the education and the the wherewithal to deal with those types of behaviors.
That's right, because it is totally different.
Right.
And people need to be placed in appropriate setting, because if they're in the wrong environment, they're not gonna thrive or survive in some cases, because it's not a proper placement. And I think that's a very good point, because, you're experts in dementia. So there are experts for assisted living, like Arden Courts, for people with dementia. And there's experts for skilled nursing, like Heartland, which is part of the HCR Manor Care family. And it's very important to know that, because what about someone who can be mainstreamed if they have dementia? I mean, it's not impossible that they go to a regular nursing home, because certainly Manor Care, part of the company, has nursing homes that don't have dementia-specific units. Some do, but not all. And someone with dementia, they can go in because they maybe aren't a flight risk, and they can be mainstreamed into the rest of the group. Is that possible?
Yes.
Yeah, I think we see that a lot when a patient may go into the hospital for some type of an acute condition. Let's say they go in and they have surgery, and they come out of surgery and they have confusion or altered mental status. So at that point, they may come to us. We're able to work with that patient, and maybe the anesthesia is worn off, or we've been able to get them to the next level or back to their prior level of functioning, and then able to discharge them, back to or mainstream back to either a regular skilled nursing facility or home, or wherever that may be.
But it's very important, too, that because, if someone's a flight risk and they can wander out, you have to be secure, which you are. And not every nursing home is secure. And caregivers say, oh, well, my husband would never leave, but you never know. And 60% of people that you never thought would wander will wander, and you can't take that risk. And certainly the facility doesn't want to take that risk as somebody. And not just walking out on their own. I mean, think about wheelchairs. If they can self-propel and they're in a wheelchair, can't they just wheel themselves out the door if it's not secure?
Absolutely.
Yeah,
it happens a lot.
It happens. So you have to be aware of that. So if you're a caregiver and you're choosing a place for physical therapy or some other skilled care, this is important to find out, is my husband going to be in a safe environment? Are there people there that are going to understand what he's going through and be able to, communicate not only with him, but then communicate to me and give me all the information that I need, because, that caregiver is the advocate for that patient. And that we all have to be on the same page with that. So I think that's very, very important. I want to talk about expectations before we end our time today. And I think it's very important that we address expectations of caregivers, what they would expect or could expect, and what might be unrealistic expectations. I'm certain that, in all the years that you all have been doing this, you probably have some examples that you could share and some tips that you could share that you would like to tell caregivers. So either one, just jump in and talk about what caregivers should expect and what would be unrealistic.
Well, one of the things that we do is when our patients come in, we call the families, and if we see behaviors, for example, someone is picking up stuff off the floor, or someone is just constantly pulling at things, and we'll call and we say, well, I see that your loved one is doing this. What was their prior living, what did they do as a profession? And a lot of times they're maybe, builders. They are used to pulling things apart. So we're going to call and we're going to, ask you these questions so we can develop a plan of care for those patients. And along with that, we may have to tell you some ugly things that, we're seeing.
And that's hard, right? That's hard
Very
for a
hard.
caregiver to hear. You don't want your kid who goes to kindergarten be the one that bites the other kids, because, you just cringe at that. But sometimes you have to share that, because isn't it your obligation?
It is. And we're asking you because we're seeing this and we want to work with you. So, just let us know. This is something that we saw around this time and we've been dealing it, and we'll go from there, because a lot of behaviors we may not be able to correct, but we can work with it because we'll have different interventions that we can use to kind of, decrease that behavior. So just let us know what it is that we have, what your family members did before, and what if we're coming to you with something, just help us.
Mm-hmm. It sounds like the more that the caregivers share with you about the person and about their history, then you're going to be able to incorporate that. I mean, same thing with us. We want to know the history and the career of the person and what they did and who they were and what their hobbies were. So we can incorporate that into their service plan to make them have a better experience and to keep them calmer and give them more of an enriching life. And so you're saying that it carries over into the nursing home, too.
Yes, it does.
Yeah, that's very, very important. What about people that say, well, my mom is in a nursing home and they let her fall? And you hear that, all right? So is it an unrealistic expectation for a family member to say, don't let my mom fall?
It is, in our opinion, but, they're going to say that. And a lot of times, we ask family members, can you provide a one-on-one, a sitter with this person? Because we actually have staff throughout the day and we keep our patients monitored, but we cannot sit right next to a patient. So we say, okay, is it okay for you to provide someone? More often the answer is no. And we have to explain.
Because they have to pay that privately out of pocket.
Correct.
And that's their responsibility.
Right.
And sometimes people just don't have the means to do that.
And we have interventions that we do put in place because we know if someone is ambulatory and they're, not well at walking, so we're going to at risk for falls. So we have hipsters that we can put on, and that will decrease the risk.
Hipsters?
Yes.
What's a hipster? I know one definition of a hipster, but I don't think that's what you're talking about.
It gives you white hips, something that cushions you if you do have a fall. Yeah. So we put that in place. So if our patient do fall, it decreases the chance of getting padding.
Okay.
Correct. But we call it hipsters, yeah. Of getting
so
that
like
fracture.
Football players, right? And you padding for the heads.
Exactly.
You have
elbow pads,
you have
helmets,
you have
knee
all of
pads.
that?
We have all of that.
And we'll put them all in place if we
Yeah.
need to, because one of the things that we try not to do is to restrict patients from, their normal function. If they like to walk around, we'll let them walk. If it's a Wonder Guard where they're going to push against the door to try and get out, we'll put that in place. But we try not to restrict. But it comes to the point where if the falls are too frequent, we have to say, come on, we have to sit and find something else because now it's past where it needs to be.
Mm-hmm.
And that's when our family members are like, well, and we usually do come up with solutions, but those are the difficult times.
Yeah, and I think, there is that expectation, but I think families really need to know that what we're trying to do is reduce the risk of injury, because we cannot prevent a fall from happening.
You can't guarantee. No one can
you
guarantee.
Can't guarantee that. And even if the patient is in a loved one's home, that it's still going to happen because you cannot be by that person's side 24/7. But our goal is to reduce the risk of injury. So that's some of the interventions that Althea spoke about, and that help us do that.
Well, I think that's really important because you have the expertise. You know what needs to be done. Perfect example, I saw a private duty with a resident, and he was standing beside her, literally standing beside her, and she turned her back to get something out of her bag, and he went down. Yep. And yes, she was literally beside him, but that didn't prevent him from falling. Yep. There's also the chicken and the egg kind of thing that I want to talk about, because sometimes people fall and break a hip. But what's the reverse of that? Mm-hmm. Right? Speak to that. Sometimes they break a hip and then fall. Have you seen that?
Well, I can speak to a situation actually that we recently had.
Okay.
So we had a patient who stood up from a chair and fell. And unfortunately, even though there was staff in the area and she was in a supervised area, they couldn't get to her quick enough.
Right.
And she fell and she did injure herself. We sent her out to the hospital, and a day later we learned that she had a stroke. So it's the same thing, the chicken or the egg. Based on her medical condition, we believe, and review of her medical record, we believe that she had the stroke, and that's what caused the fall.
Right.
So those types of situations, they do happen.
They do. So, again, unrealistic for a family member to not ever, say they can't fall, because they can have a stroke. They can have, bones can just deteriorate, and I've heard where they can just, a hip can break, and then they fall. So which really caused it.
Right. And I think in patients who are, up in age, seniors, if you will, do have some comorbidities, whether it be osteoporosis or degenerative joint disease or demineralization, and we see this frequently. And they come in on medications for that, and nothing's happened, but one day they're in pain and there's a fracture.
Right, that's
they
right.
Never had a fall.
Good. Well, let's talk about how someone could contact you, because if you're listening and you want to go take a tour of Heartland and meet with Althea, meet with Janet, ask more questions, see what Heartland looks like, because you are dealing with a loved one and you want to go to a skilled nursing facility / nursing home that knows about dementia, tell everybody how they can contact you.
Go ahead, Janet.
Well, it's very easy. You can call us at 561-736-9992. You can ask to take a tour, speak with our admissions director. You can ask to speak with myself, and we'd be so happy to tour anybody and to take you around and see what we do that's so special.
And they should do that before they need to actually move in or be admitted, because don't wait. Have a plan, right?
Absolutely.
So there's no charge to take a tour, no charge to talk to these wonderful ladies, and so I encourage you to give them a call, go see them. They'll be very helpful to you. Also, don't forget to call Arden Courts, 888-478-2410. Ask for your free 36-hour day book. It's yours just for the asking. And we will see you next week, same place, same time. And in the meantime, don't forget, give someone a hug, because they need it and so do you. We'll see you then.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teele. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.